What do you see out there today on early detection, whether it's drugs, whether it's tests for pancreatic cancer?
I would start at prevention. I think there's a lot to be done, whether it's smoking or whether it's high fructose corn syrup. If we don't start there, our problem is just going to get bigger.
We're talking about prevention, and Pedro had mentioned about smoking, diabetes. We know about the diet.
The American population is doing a lousy job of meeting the minimum dietary requirements. Fruit and vegetable intake is abysmal. I'm the CDC lead for Let's Move Salad Bars to Schools. We're looking to place 6,000 salad bars into schools across the country.
I cannot stop aging. Aging is another factor for risk factor to become pancreatic cancer. As you probably know, when you are, it's 1 per 100,000 when you're 40 years old, and it's 100 per 100,000 when you become at my age. So there's a 100-fold increase purely from aging.
We need to find something that allows us to find these tumors early on, and then we can just send them all to the surgeon.
In prostate here, we see a decrease in the rate because is an effect of PSA, and in colon is the effect of a colonoscopy.
And so we need to put some money there for sure. That will make a difference.
Personal money has been driving research. It certainly did it in prostate cancer. It certainly did it in breast cancer. And the Hirshberg Foundation is trying to do it in pancreatic cancer.
Is there really something of substance to risk my health? Or it's again.
None of us know the answers to all these things. We're all groping in our different ways to find an answer. If we had the answer, I'm sure that it would be solved if it was so simple.
All the drugs after animal trial, it has to go to human trial before its approval.
All the regulations that the FDA does have been passed down by Congress.
And I really admire a lot of the patients who agreed to submit themselves for clinical trial without knowing whether in fact it is useful or not.
You could have groups of 5,000 people with pancreatic carcinoma that would greatly benefit from one therapy that could be developed. And so, let's not go from 50,000 patients to one patient. Let's go from 50,000 patients to 5,000 patients and see if we can make a difference. That's kind of what I hope, 479 would do.
I think if we need to approach and solve the problem of pancreatic cancer, it's not one person be able to do it. It is a collective effort for us to do it.
What do we do for the young kids sitting right next to me and eager to contribute?
I always say to my young people, the future is yours. And the question then is how you to garnish the resources to be able to do what you want to do.
A lot of it is the enthusiasm of the investigator and the hope that the patients have.
And largely of this is also the effect of the Hirshberg Foundation during the last 10 years. They really have supported a lot of the seed grant to the young investigators.
I think knowledge in general, wherever it is, it's going to help us. If it's not our generation, it will help the next.
If you have the will, there is always a way to be able to accomplish it.